And so cases in school district cases since the first day of school, 134 cases, 0 cases of intra-school transmission. So that's because we are social distancing, masking, washing hands, people are paying attention. The county's numbers and the state's numbers and the nation's numbers are going down, which is all good. I'll throw some caveats in there. Our current incident rate is 135.3. That's our local data. That's not what that's what you would see on the Kittitas County website, not on the state website. To put that in perspective, around Christmas, it was about 700. And to go into phase 3 last summer, we had to be below 25 cases per 100,000. So it's definitely way down, but it's still above the peak that we had of disease in July. And that's consistent all the way across the country. Our percent positive, 6.7%. That's up a little bit from last week, 4.5% last week in Kittitas County. The hospital is doing fine. They currently have 1 COVID-19 case in the hospital, and the total number of, I don't know if it's on here, the total number of hospitalized patients for COVID is about 60 some. The biggest concern is if you just go look at our, so to do incident rate, we go back 10 days to kind of account for data lag, and then we count 14 days back. So that incident rate I gave you of 135.3 is January 30th to February 12th. So, but we have data, and our data is actually pretty good as far as not every county can get all of their positive cases as easily as we have. But we, if we just looked at the number for February 8th going back, we'd be at 116, and we kind of leveled off about there. And then about the 12th of February, we started going up, and we're back up to 159 as of February 21st. So there's a little concern about an upswing in cases. We'll talk about why that is. We are in phase 2 of the governor's new Healthy Washington Roadmap to Recovery. We went into phase 2 on February 14th. There was initially a little bit of a data snafu. One hospital entered incorrect data in our South Central region, which threw the whole region off. That was corrected. We talked about our data on Tuesday with our South Central partners, and I think tomorrow when the data comes out, they'll say, yeah, we're still meeting criteria to stay in phase 2, which gives us another 2 weeks for that moving forward. The biggest issue we're dealing with currently in the county is an outbreak of disease among AAU basketball, U14 and U16 basketball players. And so it's not really the basketball that's the problem. It's the problem is what we're doing outside of school. So that all that transmission did not occur, that all occurred outside of school, and it probably did not occur at a set of basketball games that occurred in Brewster on the 6th of February. That group of people traveled back and forth to Brewster. That group of people, they hang out together. They go to Snoqualmie Pass in a car. They have Super Bowl parties. They just do what's normal in a normal time without supervision. So supervision like we have at the schools. So we have 19 people in Upper County related to that particular incident, and we have 4 other counties involved in that. So we have the eyeballs of the state on us because we have an outbreak that actually involves Idaho as well. So I've been spending a lot of my time talking to sports parents, athletic directors about testing, about responsibility. It's the same discussion that I've had with Central Washington University athletes and staff. It's our behavior outside of school and outside of the soccer pitch determines how we get to move forward. We did yesterday do mandatory testing in Cle Elum of all athletes. So all athletes had to be tested yesterday and Thursday. They will be tested on Thursday. We had another 5 athletes, non-basketball athletes, test positive yesterday. And it's really just because those kids are all hanging out together. So I had a good discussion with parents and coaches this morning and students this morning about the response. I didn't cause COVID to happen in those athletes. Those athletes are responsible for determining whether or not school is able to be continued, whether or not sports are going to be able to be continued. So it's a lot of extra responsibility to put on those young student athletes, but that's where the responsibility should lie, along with their parents. So that's going to be my mantra going forward. We are continuing to try to encourage those kind of behaviors. We'll see how it works. So that's what's happening in Upper Kittitas County currently. Yesterday, I was on a meeting with Kittitas. They have, on Monday, they're bringing their 5th graders back. They were able to figure out how to fit in all of their 5th grade students 6 feet apart. So I was on a call with the school principal as well as a lot of parents that were on there. And I know that Thorpe is planning on bringing back all students full-time in what they're calling the 4th quarter, which is in April, because they're using their 2 gyms as classrooms, and they found a way to do 6-foot social distancing. So that's where we're at from a standpoint of disease in the county. We have a lot more concern about COVID-19 variants. So you probably heard a lot about variant disease. B117 is a variant that was first found in the United Kingdom. B1351 is a variant that was found in South Africa. And P1, which is a variant that was found in Brazil. And now there's a new Los Angeles variant that has a lot more numbers behind it, which I haven't memorized. But the variants are of concern. And this gets back into why we're pushing vaccination so hard, is that the more bodies that the virus can get into, the more likely that they're going to switch. The virus is going to say, oh, to live longer, to live better, I'm going to change to be this other organism. And so we're seeing that a lot. And those variants, especially the B117 variant, is a lot more contagious. So if we have a variant that's a lot more contagious, our numbers are going to go up. So this goes back to what I was saying about our numbers are starting to go up. We don't have a variant we've not had a variant identified in Kittitas County yet. As of last night, we had 39 B117 variants in the state of Washington. And that's not a random sample. So what happens is if I tested positive, and there's 3 markers that they look at when they do PCRs, and one of them is called the S protein. And if that one doesn't light up, then they wonder, well, could that be a variant? And those get sent to the state to be tested. We're going to start doing a lot more. The governor wants to do a lot more testing for variants. And so the plan is to increase lab capacity to test about 7.5% of all isolates for variant disease. So that dovetails into vaccination. As you probably heard this morning, that the FDA did their initial approval of the Johnson & Johnson vaccine that said it was safe, it's effective. They still have one more hoop to jump over with another group on Friday. I think it'll be approved on Friday or Saturday of this week. And unfortunately, they overpromised the amount of vaccine that they would have available. Johnson & Johnson did. So we're still going to be waiting on some vaccine. But I think what's going to happen in our county is Johnson & Johnson vaccine, because it's a one-shot vaccine, has the ability to kind of capture some people that might be more difficult to capture. So I think we're going to see that used in some of these mass vaccination clinics, for example, the one in Benton Franklin, Wenatchee, and 3 on the west side, where it's harder to get to guarantee you're going to have people come back for the second vaccination. And we'll start getting more Moderna and Pfizer vaccine into the county, which I think will happen somewhere the first or the second week of March. We're still doing second shots. I think that what's going to happen, and they're relooking at, so if you look back at the beginning of all of this COVID stuff, and you looked at decisions that were made in California and Oregon and Washington, they're all very similar. We call that the Western Pact. Those governors kind of got together and said, we should look at this scientifically. And so they're more similar than dissimilar. And in regards to teachers, Oregon and California have moved teachers up in the tiers of which groups would be vaccinated next. That's what I would expect to happen sometime in early to mid-March, is that the B2 and the B4, B2 are teachers older than 50 and B4 are teachers younger than 50. I think those will be combined, and we'll be getting vaccine in. And as our plan is to come to the schools to vaccinate teachers and staff. So that's what I think is going to happen. I'm really concerned about variant disease, and everybody wants to know about the 6-foot rule. Until we know about what's happening with the variant, if you have something that's more infectious coming, you're not going to say, hey, let's all get closer together. So the governor is really concerned about that. The governor, who I keep saying that, I like our governor, but the governor's micromanaging public health, and the governor is really concerned about variant disease. And so I just don't see that the 6-foot social distancing rule is going to change until the governor is sure that we are not going to have a huge surge from B117 variant, which is what's predicted by the models in late March, early April. So that's what I have. I'm mostly concerned about Upper County, but I am concerned about sports in general. I want you to know that we are working with trying to make it equitable for, so if a high school football team can drive to White Swan in a bus, I think that Knowledge Bowl kids should be able to do Knowledge Bowl under the observation of whoever's in charge of Knowledge Bowl. So I think there's some inequities that are happening, and I think and my kids did sports, so I'm not pointing at, sports parents are kind of crazy parents, right, Jen? So sports parents are crazy, but the sports lobby is really strong. So part of the reason that sports is going before things like Knowledge Bowl is because the sports lobbies are really strong. So if you wonder why we're able to do that, is because somebody really pushed hard on the governor. And I am surprised, because of how the governor feels, that we actually got sports happening, because the governor really wants schools to be in place before sports. But obviously there was a lot of push, and there's mental health involved, and there's a lot of reasons we should do that. But we are trying to figure out how to make that a little more equitable for all. So questions. When can teachers get vaccinated? I don't know if there's anybody who you can, we're all bending people's ears on this. I'm certainly pushing really hard on this. That decision in Washington is made by the governor. So if you want to push on somebody, you should push on the governor, because ultimately that's the governor's decision on the who gets vaccinated first, second, and third. You're absolutely correct about worried about variants. And if we can vaccinate people, it's just less likely we're going to develop variants. So herd immunity. So we'll be masking in the fall. That's what my prediction is. I don't think we're gonna get to a space where we're not going to be masking, but maybe. Are we in a need to have 70 to 90% of people vaccinated or having had the disease to be able to bring everybody back? I don't know. Central is planning on bringing all their students back in the fall. They're still trying to decide whether they're going to mandate COVID-19 vaccine for students coming and being on campus. So they're still struggling with that idea. But they're planning going forward to have full dorms and having people back. So the fitness, so this is Sam's question about the fitness program. I can't remember who at the school asked me about, so the fitness so the gym can be run as under the same guidance as gyms are run in the county under the roadmap to recovery. What I would caution you is that your primary goal is to provide education to students. So inviting somebody like me to come in and play basketball in the gym is really not increasing your ability to provide education to students. Opening the gym up to faculty and staff under supervision, that's a different story, because that is directly benefiting students. So Central has made a decision for the summer to not open anything for the community. So they're not opening the fitness center. If you have the rodeo banquet that's what usually happens at Central in the summer is not happening because they're focusing specifically on students and staff, and that would be my recommendation. But I think you can do that safely. So Inslee doesn't want all regions to move to the next tier together. I mean, he would like all regions to move to the next tier. So we don't have, we're talking about vaccine tier. Okay, so sorry, I was thinking about, so we don't have a tier 3. So in the moving forward, we'll talk about vaccines, which is, Angela, was your question, but we don't have a tier 3, but if you look at the roadmap to recovery, it says you can only do these few things, and then we're not going to just go from there to being totally open. So there has to be a phase 3 in regards to that. In regards to vaccination, that's a sore subject for all of us that feel like we've done a good job in vaccination in small communities. There's lots of discussions about equity. There's a lot of discussions on our end of don't punish us for doing a good job when some other communities have not worked as hard to get vaccine in people's arms. But That's happening currently. There have been a few places, including us, that vaccinated some people a little out of phase, and we've gotten our hand slapped. Pullman got their hand slapped. They've vaccinated teachers because they had extra vaccine available. And one other county, which, Walla Walla was going to do that. We are told we will not get any vaccine if we do that. So if we step out of line, we will not get vaccine. So we're being punished a little bit. That said, I think the tiers are going to change, and I think there has to be an ability for some places that have gotten their older than 65 people vaccinated to move forward. So I think that's going to happen. I think those are going to change probably in March. So Joan's talking about inequities for spectators. So I'm assuming what you're saying is that there should be able to have more spectators on the field. It's 200, including the athletes. That's being held as a pretty strict standard in regards to the governor's office. There's been some work in regards to that. For example, senior parents have been able to go and watch in 1 week, and junior parents able to go and watch another week. I don't think that's gonna, it's not the kids that are causing the problems, it's the parents and it's the people in the stands. And so if we can prove that we can do athletics safely, then I think some of that will change. Certainly outside, like football and soccer is obviously way safer than putting a bunch of parents in to watch a volleyball game. But they're trying to, we're trying to see how sports are going to work before that gets expanded. And as I said about what's happening in both the Cle Elum group and also up at the college, having sports, if you think having school during COVID is hard, having sports during COVID is way harder than, I mean, how often do you need to test? Should you have mandatory testing? Should, these kids not be allowed to do anything else but sports? And so that's kind of where that comes from. So World Health Organization, CDC, the state, all have different guidelines. Our current state guidelines are that people on playgrounds still need to wear masks. It gets back to who's at risk. I think your question is who's at risk of transmission. Well, the K through 5 kids are the least likely to transmit it to anyone else. And then, so I think that guidance is probably going to change, but it's not going to change until we know whether we have a more contagious variant. So Kelly's asking about prioritizing the wait list on eligibility. So anybody can put their name on the wait list. So a 17-year-old high school student could put their name on the wait list. There's a bunch of questions there. I think they have 7 full-time people looking at the wait list all the time. And so looking at who really are in the priority list, and then the decision, so it's pretty easy if somebody's older than 65 or they meet that older than 50 in multi-generational households, those people get called with an appointment. The harder ones, Kelly, are the ones where we say, oh, we had 3 people no show. Who do you call on the list to have them come in? That's the harder job that they're having. And so some of it's based upon time. With the Pfizer vaccine, they have a very short window of when they can actually call people and they need to get the vaccine. They may only have 30 minutes to get that vaccine in somebody's arms. So they start calling people, but it is prioritized, and they start at the person that's at the top that's the most risky. Why can't we sign a waiver for school? Oh, a waiver, Angela, a waiver for what? A waiver to have more kids in school? Is that what?
No,
is that
a waiver to even be able to go into the daycare. So like a waiver to go to school if insurance is the problem of why we can't have more kids in school. We have to sign a waiver for like everything for COVID.
Yeah, so it's not liability, it's infection. So the 6 foot, so it doesn't matter. Having a waiver doesn't negate the need for doing 6 foot. You can't take that responsibility on your own as a parent to say, it's okay with me that my kid is at higher risk. So a waiver wouldn't really work. There's no such thing as a waiver for the 6 foot rule, for the 6 foot rule. Student teachers. I'm not sure where we're at with student teachers. Ginger, do you want to weigh in on where we're at with student teachers?
Yeah, we're still kind of putting a hold on that for this winter season and kind of seeing how we can get testing up and going. We've gotten testing up and going now for staff members. We're looking at how to bring students in. And I have told the folks at CW that we may be able to look at doing some student teaching or interns potentially for fourth quarter, kind of depending on how the vaccines roll and what we're able to accommodate with testing.
Okay, yeah, so you could certainly expect them to show, they're certainly going to show responsible behavior in the school. They're going to mask, they're going to socially distance. And if you added testing to that, if you said, okay, if you're going to come, you need to be tested. It's not voluntary for you, it's mandatory for you to be tested, then I think you could probably make that, safe. Theaters, oh, yeah. Joan, if you want to push on the governor's office in regards to the capacity, the 25% capacity, it really gets down to the governor wasn't really wild about doing sports in the first place. But
I email him every day.
Yeah, I'll put a. You probably should talk. I'll send you an email with Salvador Salazar. He's the governor's Eastern
I will
Washington.
Contact every day. Thank you.
Yeah, no, you're welcome. And I get it. There's a lot of things that are not. Things are not consistent. And so a big part of my job currently is trying to put together, well, if it's okay for this group and it's not okay for this group, why is that? And why can't we put it together? So there are some ways to move on that, but I'll get that name to you. Yeah, it's not insurance. It's the governor's guidelines, and it's infectious disease. And if the school district, I mean, it's Kittitas School District went against my guidance to not open when they opened. Nothing bad happened. The sky didn't fall. Nothing. I mean, school districts have the ability to make decisions, but I would say you can't go closer than 6 feet. It's not without knowing where we're at with the variant. Nobody that understands infectious disease is going to say, let's take away one of the tools that we have. It's the Swiss cheese idea. It's mask, it's social distancing, it's washing our hands, it's vaccination, it's covering our cough, all of those things. But that said, I would love to have all students back in place. I really believe that students should be in school. Kelly, Ginger, you might want to ask about the question about students and staff leaving the state during spring break. So I am going to throw something in there, Kelly, before. So the reason the governor, this guidance, and its guidance says, please don't go out of state, is because it increases the risk to all of us, right? So when we go out of state, there are people that choose that they make decisions that they have to see their grandma, they have to do this, they have to do that. The more people that we have that stay home, the less likely that that we're going to have more problems. Like I'd mentioned earlier, athletics in Idaho and Arizona are a terrible idea. They're a good idea perhaps for the students, but they're a terrible idea for infectious disease. This weekend, there's a underground wrestling tournament happening in Yakima. I actually signed up to go, not as to wrestle, but to see how easy it was. $10. You can get an Eventbrite admission ticket to go watch high school and middle school wrestling in Yakima. So people are still doing things that are not safe. And if you choose to go somewhere over spring break, my request would be to hang out with your immediate family bubble and wear a mask if you're around people that aren't in your immediate family. So Ginger, do you want to answer that question?
Yeah, absolutely. So we're looking at some guidance that we'll be sending out to, we're hoping to be able to send that out to all staff by the end of this week. And what has changed? Well, you know, back in November, we didn't have the plethora of antigen tests that we do now. We had access to some of them before winter break, but we hadn't had a chance to kind of mobilize and get nurses used to it and put together a system. So now we do have the ability to test. And so, you know, we're looking at, if people go out of state, asking them to test, you know, before the spring break, as well as again, like on a Wednesday or Thursday of that week, just to keep everybody safe. But that's what we're looking at. But we'll send out something official before the end of this week. Shouldn't take longer than that. All right, are there any other questions?
So Salvador Salazar is the Eastern Washington representative for the governor's office. And that is his email address. He's a really nice guy. He will get back to you. I'm not sure how powerful he is in the governor's office, but he's our guy. Like I said, I'm working on the inconsistency pieces. That's really frustrating to me. It was really frustrating, for example, that a high school athlete could go run an indoor track meet at the University of Washington without a mask, and Carly could run in a 5K without a mask, but the cross country runners in high school had to wear a mask. It made no sense to me, and there's a lot of things that make no sense. So I can usually get some, I can at least get some people to listen that the guidance doesn't make sense, which, you know, if you push on those things, that if we push on the things that are inconsistent, we have an ability to move those things. If we, like the California and Oregon are prioritizing teachers, why are we not in Washington State? I mean, so there's some things that we can do. Yeah, I'm working on the band thing. My kids were band kids too, so not that that's why I'm working on that, but I understand the value, and Joan, I too will reach out in regards to the number of people watching outdoor sports, right? If we have a family that's sitting together as a family on a bleacher 6 feet away from another family, then there's not really great risk. So maybe it's 200 pods, 200 family pods watching, so there's some things to work on there. Everybody has complaints about all of those things. None. So Carly asked, based upon current vaccination numbers, what are the odds of us making to 70%? I think it's none. I think it's going to be really, I think it's going to really be difficult. It's going to be me calling each individual person and saying, what is really the most important thing to you? And then if they say the most important thing to me is having marching band back, and then I'll say, well, then you should get vaccinated. That's the reason to be vaccinated. I think it's gonna somewhere we're gonna switch from having a bunch of people that are wanting to be vaccinated to not having enough, and those 50 to 70% to reach that 70% herd immunity. Those are going to be the tough ones, because we're going to have to reach out to the homeless. We're going to have to reach out to, I'm working hard on Central to try to make that mandatory for vaccination of students coming back. That'd be an extra 8,000 people in our county that are vaccinated. But I think it's going to be a heavy lift. It doesn't mean we can't. That gets back to 70% hard line for us. The answer is no. It's not. So we have currently 17.29% fully vaccinated people in Kittitas County, and 17% of people that have gotten at least one vaccine, and 6.26% fully vaccinated. We got a lot of distance to go. As we get more vaccine, that number is going to go up pretty rapidly, but then we're going to stall at that about 50% spot. Yeah, learning gaps. Yeah, that's a terrible thing. And it's not just, it's terrible for all of the people that you deal with, but especially the juniors and the seniors that are trying to move forward, and those people that have just graduated. The people that are in third grade and fourth grade, they're going to catch up. They've got enough time to catch up. The people that are at a huge disadvantage are the two years before high school graduation and the 2 years after. Sorry, Jen, but you know that's true. It's hard. 70% of teachers. Yeah. So the key really is having enough people vaccinated that it doesn't really matter if there's one or two people that get the disease, because that disease doesn't have a chance to spread to others. It does appear that the Johnson & Johnson vaccine stops spread of disease. That's really, the goal for me is to stop people dying and ending up in the hospital. But really, the secondary goal, and especially the goal for school, is does vaccine keep us from spreading it to others? And it appears that the data from the Johnson & Johnson vaccine is that it does. So that's a good thing. And thinking about those people that are vaccinated. So, and now I'm going to pick on Jason, I suppose. So if Jason's fully vaccinated and somebody comes to his office and has COVID, and he spends 30 minutes with that person, it doesn't really matter. He doesn't have to go in quarantine. So that particular bit, or if Joan has a kid that has COVID, but she's vaccinated, then her class can continue moving on because she's not at risk. And so for 90 days, that's the data we have currently, is that just like with natural infection, we're at 90 days that people have immunity. It's probably more like 6 months. And I think that's going to change rapidly, and hopefully it'll be longer than that. But right now it's 90 days. Yeah, you guys make me really tired. This is how most of my days go. It's like 1 hour after the next of this. So next I'm with the school superintendents. We'll talk about the same things, and then I'm with the faith-based organizations, basically all the pastors and the priests, and because there's a whole group of people, there's all these groups that really need to hear the same thing, and they need to realize that, if you're a pastor of a church, you should be encouraging your people in your church to be vaccinated. So,
well, and Dr. Larson, we're really excited to have you at our board meeting at our study session too. We are, the board is receiving a lot of letters from parents who are eager, like we all are, to get all of our students back and get more students back in school. So I really appreciate your being there with us at 4:30 to be able to add that public health perspective to some of the questions that are being asked.
Sure, 4:30 to 5:30 and 6 to 8 today with you, Ginger, plus 1 to 2 and 12 to 1.
Just can't get rid of me today, Dr. Larson.
It's a Wednesday.
I know. All right. Thank you, everybody.
All right. Thank you.